everyone, I'm Dr. MabelMD, board certified dermatologist. Today I want to talk about a procedure that is usually confused with botulinum toxin injections. So last week we talked about botulinum toxin injections and how it relaxes the muscles. But some patients kasi come in and they ask, Doc, can you Botox this para mag-improve? No, the Botox is not the answer for this kasi medyo depression na yan or hollowness na yan. So what you need is something that will fill it in. So that is usually hyaluronic acid fillers, or recently what we use is biostimulators to give it a more natural boost of collagen plumping. Okay? So biostimulators are actually my favorite way to improve the hollowness of your face because it also gives you that hydration that you need. It makes your skin really look young and plump and just youthful overall. The downside is it takes a while for you to really see these effects. So sometimes after this injection treatment, you have to wait about 1 to 3 months before you can see any visible improvement on your skin. And ako personally, it depends on the product that I'm using. So if I'm using a hyaluronic acid, the non-cross-linked biostimulator, so I would repeat that every 2 to 3 months, and I can combine it with other procedures just to give you that glow, that overall glow. So, but if you want something that is like immediate, instant effect, then you go for hyaluronic acid fillers, the traditional hyaluronic acid fillers, because hyaluronic acid fillers are traditionally hyaluronic acid that are like connected to each other. So when they're connected to each other, they stay there and then they get water. That's why it becomes plump, and that will last you about 6 to 12 months. Whereas if you use the newer biostimulators that are hyaluronic acid or polydilactic acid, when you inject them, because these are non-cross-linked hyaluronic acid, meaning hiwalay-hiwalay sila na hyaluronic acid, so when you inject them there, they are absorbed by your skin and they trigger a natural reaction to produce collagen in your skin. But again, the downside is it takes a while, but the upside is it looks super natural and it's really less scary. I find it really super safe. So hyaluronic acid fillers or biostimulators, they usually come in a syringe, and we usually change out this. We can use a needle or a cannula, and we inject it to specific sites of the face depending on the product specification. You can combine biostimulators, hyaluronic acid, PDLLA with botulinum toxin because these treatments address different things for our body. Again, but botulinum toxin will address your wrinkles like this, but hyaluronic acid fillers will address all the depressions of the face. So I hope this helps. Bye!